What's the #1 cancer in men? Let's talk about it. As many of you probably guessed, it's prostate cancer. So in this video, I'm gonna go over screening tools for prostate cancer, signs and symptoms of prostate cancer, and if people with prostate cancer come on to hospice. The prostate gland is a gland that surrounds the urethra in men. It's a male gland located underneath the bladder in front of the rectum, and it's about the size of a walnut. The exact cause of prostate cancer is unknown, but there are several factors that come into play that make you more likely to get prostate cancer. #1 is genetics. Prostate cancer is a major cancer that is hereditary. More than 50% of cases are caused by genetic factors. So men who have a close relative who has had developed prostate cancer, especially before the age of 60, has a 50% chance of also developing prostate cancer. Also, if a man does carry certain genes, specifically the BRCA1 or BRCA2 gene, this gives you an increased risk of developing prostate cancer. And just as an FYI, you can screen for those genes. Age is the second factor. The older you get, the more of a risk you have in developing prostate cancer, specifically over the age of 50. The third is diet. So anything that's high in fat or animal protein. So if you're a man who is eating steak day in and day out, it can damage your DNA, which could lead to cancer. The fourth factor is race. Prostate cancer is more common in Black men than Asian men. The fifth is obesity. Some studies have shown that men with obesity have a higher chance of developing a more aggressive prostate cancer. Okay, and last but not least, other factors. Other factors include things like hormonal factors, if you've been around pesticides, and just different lifestyles. So is there truly anything like a good cancer? I have heard that before, like, oh, prostate cancer is a good cancer to get. And really what people mean is it's a survivable cancer. And this is true. Technically speaking, prostate cancer is usually found in the first 1 or 2 stages, meaning it hasn't moved anywhere else in the body. And because of that, they have a pretty standardized treatment for prostate cancer, and it is a very survivable cancer, at least at first. In nearly 100% of all people who have prostate cancer, if it's caught in the first stages, 1 or 2, where it hasn't moved out of the prostate, the 5-year survival rate is 100%, meaning you will live past 5 years, and usually extended. 10, 20 years after that as well. However, where prostate cancer becomes an issue or becomes terminal is when the prostate cancer has metastasized to other parts of the body. Sometimes this happens when there's a reoccurrence. So you had prostate cancer, you had it treated, 10 years later, you get it again, and it has moved to another part of the body. Then it could be classified as, stage 4, and it may be a terminal cancer. So as a hospice nurse, those are the patients that I see. I do see patients come onto hospice with terminal prostate cancer, and it usually metastasizes to the bone. Now, there are other parts of the body it can metastasize to, but I typically usually see prostate cancer metastatic, meaning move to the bone. There are other types of prostate cancer. The 2 I'd like to talk about are ones that are very, very rare, but they are usually aggressive and terminal. The one that is rare, but it is usually really aggressive and terminal, is neuroendocrine prostate cancer. That, I think, is different than like the quote unquote regular prostate cancer. It's just more aggressive, and it usually is eventually terminal. And then there's another rare kind of prostate cancer, which is really a different type of cancer called a sarcoma, which is a type of tumor, which can be very aggressive. It can be found basically anywhere in the body. However, it can be found in the prostate, so it would be a sarcoma that's in the prostate, which again is rare, but is usually and eventually terminal. I do want to say this very quickly, that some prostate sarcomas can be very aggressive and deadly, and some are not. So it does depend. So when should you start screening for prostate cancer? Patients who are at average risk should start screening for prostate cancer at 50 years old. Men at higher risk with a family history of prostate cancer should start at age 45. Just talk to your doctor about screening. Prostate cancer doesn't usually cause many symptoms in the earlier stages, but some men do notice these symptoms. So generally speaking, urinary symptoms, difficulty starting urination, weak or interrupted flow, frequent urination, especially at night, trouble emptying the bladder, so feeling like you need to go more but it's not emptying, burning sensation when you urinate, or blood in the urine. The second symptom men might notice is trouble getting an erection, painful ejaculation, or even blood in semen. A third thing men might notice is lower extremity issues, meaning weakness in the legs or numbness in the legs and feet. And then other symptoms that are very general, but pain in the hips, in the pelvic area, unexplained weight loss, that's always a big one for cancer, unexplained weight loss, tiredness, and possible loss of bowel and bladder control. Okay, so what do I see on hospice with prostate cancer? Again, usually when someone comes onto hospice with prostate cancer, unless they have those rare kind that are more aggressive, we might see them sooner, but usually with the typical prostate cancer, we will see someone after the prostate cancer has reoccurred. So they had it once 10 years ago, everything was fine, and it has reoccurred and now has metastasized, usually to the bone. So the main symptom I see with that is pain. Many people already know that cancer in the bone can be painful. Sometimes I do see men with prostate cancer metastatic to the bone that don't have much pain on hospice. Other times, I think depending on where it's at, it can be very, very painful. I do have good news though. We are great at managing pain and we are great at managing bone pain. So a lot of things we do for bone pain are steroids, which helps with inflammation. And we do have different pain medication methods that can help with specific pain like bone pain. For instance, I have definitely seen a drug called methadone work very, very well for nerve pain or bone pain. Now, methadone gets a really bad rap. It has helped many people get off heroin and drugs. So there's methadone clinics where people use like a maintenance of methadone so they can stay off harder drugs, and hence why it's got a bad rap. But we've also seen on hospice using methadone for patients with certain types of pain where other pain medicine hasn't really helped with their specific pain. And that's usually because methadone can work on two different types of pain receptors in your brain, which is why it can really help with certain types of pain. So the main symptom I see on hospice with prostate cancer, like I said, is pain. And then I always will see the general symptoms I always see with everybody, right? So decrease in appetite and thirst, increase in sleep, decrease in functional ability, right? So they're going to be in bed a lot more, sleeping a lot more, eating and drinking less. This is for anyone on hospice. So people with prostate cancer on hospice will also do like the regular things that everyone on hospice usually does, which is decrease in functional ability, increase in sleep, decrease in food and water intake. The other symptom I'll mention is obviously issues with urination. So sometimes people with prostate cancer will have a permanent catheter to help with urination issues. Not all the times, but sometimes. The message I really want to drive home with this video is that screening for prostate cancer is so important. If you are a man in your 40s and definitely in your 50s, you should be screening with your doctor for prostate cancer. It is a very survivable cancer and can be treated quite easily at times. So please, if you get anything from this video, it's work with your doctor to screen for prostate cancer.